So
Yeah.
You will start, right?
Yes.
Good evening, everyone. Thank you for joining us for the webinar about a glimpse into a multi-specialty integrated practice model with the Permanente Medical Group. Tonight, we will hear from Elise Weinstein and Humberto Temperini. And I know we're a couple minutes late. We had some issues logging on with our slideshow, so I'm sorry for that. But I'm going to give some people a little bit more time to log on. And while everyone's still logging on, I just want to take a moment to introduce myself. My name is Peyton Jennings. A lot of you who are on Practice Match probably know me just because I'm the physician engagement coordinator. And I deal with a lot of the physician promoters for our career fairs. Before Practice Match, I was in an internship role for a hospital that actually worked with Practice Match. So in that role, I realized how much I love helping residents and fellows, guide their way through training just in the easiest way that I could. So with Practice Match, I get to do exactly that with all the career fairs and the webinars, and I'm very grateful for that. So hopefully, since you're here already tonight, you know a little bit more about Practice Match and all that we have to offer physicians. If not, I just wanted to highlight a couple things that my team and I have available to you to make sure that you get the most out of your experience. We have free CV rebuilders. We have scholarships, the virtual career fairs, monthly webinars, a free physician immigration handbook, and a physician practice path career guidebook. If you have any questions about those things, feel free to reach out to me though, and I can give you a little bit more information. Please note that microphones will be muted throughout this presentation. We'll have time for a Q&A session at the end. So if you have any questions while our presenters are presenting, just go ahead and put those in the chat box and we'll get to those at the end. So now that you know a little bit more about me and Practice Match, let's learn more about a multi-specialty integrated practice model. Here is the Permanente Medical Group.
Thank you. So I can't tell if you can see me, but I'm wondering if can you? I don't know. So you can give me a thumbs up, Peyton, if that's the case. My name is Dr. Elise Weinstein, and I'm here with my colleague, Dr. Humberto Temperini, and we are both psychiatrists with practice at the Permanente Medical Group. And we thought, given that you're looking around for different practices, this might be an interesting way to practice, and we want to tell you about why we joined and what being in a big group is like, especially being one of many multiple specialties and how to work integrated. I've been with the Permanente Medical Group close to 30 years. In my career at the Permanente Medical Group, I like to say I've had 5 different careers. Currently, I'm the former chief of mental health, and I practice in the Marin County, Northern California area. But I'm also a physician coach and the leader of physician recruitment. I'm going to take a moment to have Humberto introduce himself.
Thanks, Elise, and thank you so much, Peyton, for having us here. We really appreciate the invitation. Good afternoon, evening, everybody. Humberto Temperini here. Just like Elise said, I'm a psychiatrist. I'm in Northern California, and I'm one of the 9,000 doctors that conform the Permanente Medical Group, which is what you're going to hear about tonight. We are a multi-specialty medical group. We are based in Northern California, where we have approximately 4-point-something million members. These are people who get care with us. We're distributed all across Northern California. I've been with the medical group now for about 11 years. After a career in academics at UC Davis and a couple places in the East Coast. And probably the best decision I made was eventually to come to TPMG. So let's get this going.
Okay, thank you, Humberto. I'm getting a note that you can't be heard well. So next time you talk, hold the microphone close to your mouth. So yeah, so next slide, if you don't mind. And forgive my background, I'm at a camp up in Northern Michigan, so I'm in this rustic setting, but okay. So one thing when you're taking a look at jobs, you wanna look at who are the payers, who are the people in the systems. So for Kaiser Permanente, that actually means Kaiser, meaning 2 entities, Kaiser Foundation Health Plan, Kaiser Foundation Hospital. And then there's the medical delivery system, the Permanente Medical Groups. And the one that Umberto and I are from is Northern California, or the Permanente Medical Group. We call it TPMG for short. And we have an exclusive relationship with the payer, which is Kaiser Foundation Health Plan, so the insurer. And we only practice in the bricks and mortar of the Kaiser Foundation Hospital. So we're integrated in the sense that we, our patients, we call members of the health plan, and we practice in the office buildings of the Kaiser Foundation Hospital. But we are the for-profit arm, a big medical group. At least in Northern California, we have 9,300 physicians, and close to a little over 400 of those are psychiatrists spread out over all of Northern California. So when you are looking for jobs, who owns the hospitals, who owns the buildings, how are you going to get paid? For us, it's an exclusive relationship, so we can focus on the care of our members. Next slide. Umberto, anything that you want to say about our integration with health plan?
Absolutely. So as Elise said, that we're talking about the three entities, and just before that, can you hear me now? Is this a little bit better, or is it still like kind of spotty?
A little bit, but if you could a little louder.
Okay. So once again, the main issue, what we call an integrated healthcare delivery system, is the fact that our patients basically are at the center of everything that we do. And so when we're talking about an integrated system of care, we're talking about is these three different entities that Elise mentioned before that conform the practice setting in which we actually practice every day. So basically, the member, who is the patient, basically can choose the Kaiser Permanente to provide insurance. And then we have the Kaiser Foundation Health Plan, which is the insurance arm of the triad. And as Elise said, we are the Permanente Medical Group, which is the physicians, and then we have the buildings that are around us. So, the three of us function together to provide the best care for our patients. Again, there's 4.5 million members that are in Northern California.
Thank you. Next slide. So we are only one of the Permanente medical groups. We're actually all over in California, where there's 8 different medical groups in the country that all take Kaiser Foundation Health Plan and practice in Kaiser Foundation hospitals or contracted hospitals. So we're Northern California, that's TPMG. Southern California, you kind of split the state in half, is called SCPMG. There's one in Oregon called Northwest PMG, or Washington, WPMG, Hawaii, Colorado, Mid-Atlantic, which is MAPMG. We call that Mid-Atlantic state. So it's Washington, DC, Baltimore, and Virginia, and then one in Georgia. And we're all connected. And all told, all physicians, 23,000 physicians under this umbrella called Permanente Medicine. You can Google it, you'll see articles. We do a lot of research, tons of teaching, and we'll tell you a little more about that. So next slide. Umberto, take the next one.
So what are we based? What is it that you get when you're a TPMG physician, for example? What are our principles that guide everything that we do every day? So, we put the patient at the center of everything that we do. And that goes basically from everything that we do is patient-centered. So for example, for you to get an idea of this, our doctors are not incentivized by how many patients they see. They are incentivized by how much better their patients get. So for example, in primary care, doctors get a bonus depending on how many patients of them achieve the right hemoglobin A1C levels, how many patients in their panel are able to have their high blood pressure controlled, how many patients get a colonoscopy on time. So that idea that the best care is basically provided because of the patient and what basically are looking at outcomes for the patient, that is one of the core philosophies that TPMG has. We're a multi-specialty group. What that means is that we have every single specialty under the spectrum, that are all physicians that are all part of the Permanente. What that does is it allows you to ask any of our physicians questions about how to provide the best care for your patients. As a psychiatrist, for example, we typically have questions about things like medication interactions. A patient who may have a cardiac abnormality, can they actually be safely prescribed a stimulant medication for ADHD, for example? It's very simple. I can reach out to our cardiology department we have a system that allows us to do that from my office. I can just send a quick question. Hey, can you look at this person's EKG? Can you tell me if it's okay to prescribe this medication? So that is one of the things that provide a greater satisfaction for our physicians, to be able to consult with doctors in a very easy and formalized way that becomes part of the record. We put a lot of emphasis on prevention and detection. Once again, we have multiple programs that are geared at minimizing the risk of illness by decreasing any factor that may actually provide, could make that outcome worse. For example, diabetes control, hypertension control. We look at that across different populations with a lot of different markers. And so we are very, very eagerly, focused on that. We put a lot of emphasis also on information and technology. Every physician that comes to TPMG gets afforded with a lot of different, tech gadgets. So we all get, you get a phone that has absolutely everything on it that allows you to both communicate and provide care. You can access the medical record from your phone if you want to. And then you get your computer, which allows you to do work from home, for example, and do video visits. And, that's something that we have, put a lot of emphasis, particularly over the past 18 months, since we started with the pandemic. Over the last 2 years when we have the pandemic, it has been something that we have definitely focused on, and we have pivoted our efforts towards a telehealth platform. And finally, this idea of prepayment. So again, our membership is prepaid. Basically, patients do not pay, their premiums. This is prepaid medicine, basically. So it's not like a fee for service. That's a difference from a different model of care where people have a fee for service, where every time you go to the doctor, you basically pay a fee. You pay up front, and basically then the care is administered through that. So those are some of the core principles that we have. Sorry, Elise.
Yeah, so this is like our genetic code. And yes. To just drag home a few points, the integration, we're integrated with our therapists, with social workers, with our nurses and our pharmacists, our lab, our neurology, the peds and the child psych departments meet together. The neurologists and the dementia geriatric psychiatrists meet together. And it's all to streamline and put the patient at the center. And if you're stuck, you never worry alone. For example, I was on call once, and I got called from an inpatient unit, and we can talk about what the psych services are and the medical group in a second. And a person had a wrist laceration. And I'm like, well, I don't know a hand surgeon. So I look on my handy dandy phone, look up hand surgeon. And I talked to the hand surgeon who said, yeah, just send him to my clinic in the morning and we'll sew him up. And I had arranged the transport with them, and boom, done, hand surgeon. Okay, who knew we had one on call? So anyway, that's just, it's designed to take care of the patient, but also make your job easier. And one of the things when you look at it, if you're thinking of working in a system with lots of colleagues, is how is it? What's the supports? How easy is it for you to get a hold of a specialty, to consult with the OBGYN on hormonal treatment based on mood and things like that? And then lastly, the prepayment. So our physicians don't know what an RVU is. We pretty much just take care of the patient. We say, if you're doing the right thing, then don't worry about it. We have a big formulary. We have chiefs of psychiatry, and they help set our formulary and our best practices. So let me see what the next slide is. And we can also take questions kind of on that.
One thing I was going to add to that, we can go to the slide, but in the meantime, as we're talking about why physicians choose TPMG, one thing is also that our physicians are very carefully selected. As Elise said, when you have 9,300 physicians, we want to make sure that the people we take, basically the people who actually get an offer from TPMG, are people who, in addition to being clinically excellent, which is the basic tenet that we want for our physicians, they are also practicing with group excellence, and they have interpersonal excellence. We want people who are able to get along. We're people who, are not basically people when you ask them a question, even if your question sounds or you think that your question sounds very basic, or, oh, I should know this, I'm afraid to ask this question because I'm already a physician, I'm no longer a resident now, right? Those questions are welcome. The idea is to practice in a collegial environment where those questions are actually welcome. And because, again, the center, as we said at the beginning, the center of the whole care that we provide is the patient. Okay. Sorry, Elise, I just wanted to put that out there so that we actually do put a lot of emphasis on the type of physicians that have us joining the group.
Yeah, thanks, Umberto. You're right. And we can actually make this a conversation. We're in 2 different states at the moment, so we don't know what each other is going to say, so forgive us. But Umberto was talking about the practice environment, and that's really true. The support you have with the other colleagues, like in my clinic, we have all 18 psychiatrists. We're on a Teams chat. We'll support each other. What's this? Have you tried this new med? Have you gotten this side effect? And if we don't know it, somebody does in the medical group. So one of our tenets is never worry alone. And that really, really is welcome to ask questions. Also, everyone that starts gets a mentor. You're onboarded slowly. You're given a lot of tech tools. We have people called tech leads, and they are given time with you to bring you up to speed so you get super efficient. We want you out and enjoying the gorgeous state of California. But it's all about the support and the practice environment. And we survey people. So why did they choose the Permanente Medical Group? It's reputation, but also stability. This is kind of a rock and roll time in healthcare. I'm sure you feel it. We feel it. This medical group has been around for 75 years. We say it's a stable ship in rough waters. Our salaries, our pensions, all the benefits we get are rock solid, and it's designed that way. They're pre-funded, and we're shareholders, so we all own a bit of the group. And we can talk about that more if people are interested in that, but that's one thing to look at when you're looking at different practices. So next slide. Okay, Umberto, you want to talk about all the other things you can be?
Absolutely, yeah. So typically when you join TPMG, most people start as we're all full-time clinicians, right? But in addition to seeing patients on a day-to-day basis, there are a lot of opportunities to do things outside the daily practice. So, for example, in addition to the possibility of joining the ranks of the physician leadership, which is something that we have trainings for, one of the things that are amazing about our organization is that we do train our people, and we have a company that is an financially extremely valuable company. It's an $11 billion company. This is what we have. And it's so important for that we have physicians that are running the company. And when you have a company of that magnitude, the physicians that run the company need to have the right training. Now, most of us did not come to the medical group with a business background or an MBA or things like that. So throughout the trainings that you get through the medical group, you can actually understand more things about the business of medicine and understand about how to become an outstanding leader with the Permanente Medical Group. So we do, in addition to the physician leadership part, which is something that some people are interested in doing, we have a lot of other things. For example, like you can participate in things throughout your medical center. There are a number of different committees that range from the Pharmacy and Therapeutics Committee to the peer review to the credentialing committee. There's committees that are all formed by physicians that are volunteering in there. Now, the interesting thing is, like, unlike other organizations where when you become part of any kind of administrative process, that's something that happens in addition to your clinical duties. At TPMG, when you're actually meeting, when you have time to prepare for these meetings or things like that, you get the time allotted to basically do all that work. Okay, so I remember when I was in residency, I got the amazing task of making the call schedule. And the call schedule was typically made on a Sunday, where I would spend 6 hours trying to put together call schedules for the next 6 months. Well, we have obviously, that was like the first administrative job that I ever had. And obviously I was doing it all of my time. So with TPMG, if you're asked to do anything like that, if you're asked to have any kind of administrative role, you are given the time to be able to do it and to do it right. In general, when you're asked to do these things, you get not just the time, but also the training, and you typically have people who are advising you on what to do. So that's the part with training. In addition to that, we actually, the commitment to, quality is, fantastic. We have consultants that, help us in providing the best customer service for our patients, and again, these are all things that you can be involved. These consultants are physicians, just like you and I, that basically are interested in assisting other physicians to become better at interpersonal interactions. We have physicians who are very, very much interested in working in technology. And so we have digital technology leads that are people who are in each department who basically help our physicians, maximize the use of the electronic record and all of the tech gadgets that we were talking about before. We have, a huge emphasis on health education, teaching with many of our medical centers involving residency and medical student education. So again, the non-clinical, what we call non-clinical time, is abundant, throughout our organization in Northern California.
Thank you so much. Whether you like teaching, we have 2 residencies going on 3. Whether you need to learn, we'll send you to learn the TMS and ECT, probably as residents, you already know that, but if we are starting a program, we'll teach you. Also, if you want to be a leader, you're going to be asked to step up, lead a committee. If you become a chief, you go to chief school. If you become a leader, you go to emerging leaders school, or you're supported. And one of the things to think about is when you're looking for a job, are the people doing the jobs who've been in that role for 5, 10, 15 years, are they doing the exact same thing as when they started? If they want to, great. If they want to be developed and learn more things about their profession or the field of medicine, then you can do that at the medical group. I started and I was a psychiatrist, very happy to do so, raising my family, and pretty soon was tapped to lead a committee. I thought, I could do that. And then I wrote best practices for depression. And then I took on some other roles. So anyway, the point is, how are you developed? And next slide. Okay, well, we are in Northern California, so this is our fancy fun slide. And this is in San Francisco, particularly, as one of our service areas. So there's a big medical center there, and all over Northern California. Next slide.
And you can go everywhere pretty much. You can ski and surf on the same day if you want to. Napa Valley, which is an amazing place which is always very close to all of us. Outdoor activities are second to none in Northern California. Plus the fact that the weather is not a variable like everywhere else. You can basically between March and November, you can count on basically not seeing a drop of rain. So you can always plan something knowing that it's going to be a sunny day pretty much. And you'd be surprised, but that ends up being something that you forget about. So now I'm in Boston and it was raining yesterday and I was, what's this? What's going on raining in the summer? Because I forgot what it was to basically be anywhere else outside of Northern California. So the lifestyle is phenomenal. We do a lot of assistance for people to be able to buy homes in Northern California. That has a reputation for being, a very expensive area to live, and it's true. But the medical group helps you with a number of different things, so you can make that transition to the area much easier.
Okay, next slide. And I know we're bumping up against some time, so if you want to take a picture of this slide, we are at, this is where you can follow us. We're on social media, and we're at tpmg.permanente.org. And we actually have some other programs coming up where we offer DoorDash credits, but it gives us a chance to spend more time with you, get to know you, tell you about our benefits, what a shareholder is, and also about the practice of psychiatry. So even in a psychiatry department, I'll just get this in really quick before we end, you have psychiatrists in all flavors, all specialties, all fellowships. Umberto's, what's your forensic?
Forensics.
Okay, so we'll have forensic, geriatric, child, addiction,
CL.
CL. Yeah, so we're a very rich department, but we also have several layers of care, from residential care, inpatient care. We have 2 spots for inpatient practice, actually more than that, but we'll tell you more about that. And most of the time it's outpatient, and we have IOPs and residential care and all kinds of interventional psychiatry. So there's lots of a very rich practice. Next slide.
That's it.
I think is that it then? Okay, I thought we had a slide of our upcoming events, but I don't see it there. So if you are interested, we are happy to give out our emails, and I'll just spell it because I guess I could put it in the chat. Can I do that? So, okay, I'm gonna put my
emails in the chat. Yeah,
I'll put my email in the chat. So we'll try that.
Does anybody have any questions before we wrap up today?
Okay, well, we are doing, I think later in the fall, a psychiatry virtual dinner, but we also do different dinners where we highlight our different medical centers. But really for residents, I just want you to walk away with 3 things. One is, who's the payer and who cares about the patient and how you're going to take care of that patient, what supports you have in your practice. They're tremendous with the medical group. And I was blanking on number 3, but I'm going to say, because I have many I can choose from, but what I wanted to say, I don't even remember. But anyway, benefit package, I'll pick that one because we have many, but our benefits are truly amazing. Any last words for you, Umberto?
No, so only that, when people join us, our goal is for you to come join us and for this to be perhaps your first and last job. We want you to come to work with us and to retire with us. And we are very successful at doing that. Once people basically achieve what is called senior status or, shareholder status, about 95% of them basically stay with the medical group until retirement. That's a pretty big number. And that basically goes to the commitment that the medical group has towards the quality of life of our physicians. And the amazing benefits package that makes it basically second to none when it comes to choosing a career. So if you would like to hear more about it, we're happy to tell you. It's a whole other conversation because we have to show you. It gets a little complex because we talk about pension, we talk about all the retirement plans, we talk about the amazing benefits that you get, and you talk about how good the salaries are, plus all the incentives that we have for recruitment, housing, moving expenses, all these different things. So happy to talk to you more about that anytime. I put the email addresses for Elise and myself in there. Feel free to reach out to us and we will connect you with everybody that needs to provide you with answers.
Okay, well, thank you, Peyton, for your help tonight, and I hope everybody has a good night.
Yep, thank you guys, and thank everyone.
Thank you so much.
Thank you everyone for attending. If you like this webinar, this will be posted on our website within the next couple days. So you can go back and watch it if you have any other questions. And then we also have a couple other webinars coming up. I believe the next one is on August 2nd. So again, that'll be on our website too. So if you were interested in any of those, just feel free to check those out. So thank you guys again.
Thank you so much.
Have a good night.
Bye. Good night.
Bye-bye.